Hey everyone, welcome back to Political Prude, the podcast. Now, before we jump in, hit that follow button and give us 5 stars on Spotify and Apple Podcasts if you like what you hear. And if you're watching on YouTube, smash that thumbs up button and subscribe so that you don't miss out. This season is all about finding out how things work in Singapore. Today, we're exploring something I'm extremely curious about: how Singapore deals with crises. Of course, we have the perfect case study in COVID-19. It may really feel like ages ago and that we have all moved on, but I do think that there's value in reflecting and processing our entire experience. Now, COVID was a real-life stress test for our entire country and also our government, pushing our systems and revealing how decisions get made under pressure. By looking back at how Singapore handled the pandemic, the tough calls, the quick changes, we can really get a clear idea of our leaders' playbook for any major crises, be it economic downturns, supply chain chaos, or, well, a global pandemic.
Deputy Prime Minister Gan Kim Yong, Trade and Industry Minister Gan Kim Yong,
Health Minister Gan Kim Yong.
I've been dying to ask some of these questions for 5 years now.
Singapore has seen its first local transmissions of the coronavirus.
The city's usually bustling financial hub has been brought to a standstill.
Do we have an SOP? How do we go about dealing with situations like COVID?
When we handled the COVID-19, we decided from the beginning that we will maintain transparency. Good news, bad news, doesn't matter. We will share with them so as to build trust.
First country in Asia to get the Pfizer-BioNTech shots.
Photos and videos of empty supermarket shelves flooded social media over the weekend.
Some countries actually played dirty. Were there opportunities for Singapore to play dirty?
Our approach has always been a collective one. Unless the world is safe, Singapore will never be safe. I actually work with all 4 prime ministers.
You're now the DPM. What would that brand of leadership look like for you?
Singaporeans really want to know who you are, what you stand for, and how do you intend to bring Singapore forward, and how do you intend to improve my life.
In 100 years, there can be a gun GPT.
AI won't be able to decide for you. You may have the benefit of all my wisdom and my experience, but at the end, you are you and you are not me.
Now today, I have Deputy Prime Minister and Minister for Trade and Industry, Mr. Gan Kim Yong, on our show. Crucially, he also co-chaired the multi-ministry Taskforce on COVID-19 from 2020 to 2023, which directed and coordinated Singapore's response to the pandemic. I believe that DPM Gan has a unique insight into navigating high-stakes situations. How does Singapore really make those tough calls when facing the unknown? What goes into the decision-making process during a crisis like the pandemic? And what does it take personally and collectively to steer this country through that kind of pressure? And how do these intense experiences ultimately shape Singapore's approach for future challenges, whatever they may be? Well, I got questions, and DPM Gan has the frontline experience. Let's get into it. DPM Gan, welcome to Political Prude, the podcast.
Thank you very much. Happy to see you.
Yes, I understand that this is your first podcast, so I'm hoping that it will be a good experience so that you can do more next time.
Yes, hopefully.
Yeah, so my first introduction to you was really COVID-19, I think that was the first time I really took notice of you, and, just seeing you every day on TV was just like, okay, like this is kind of a new figure for me to look up to. I'm curious as to how we as a country would approach a crisis, right? I think things like, do we have an SOP? How do we go about dealing with like situations like COVID is something that I'm curious about.
Mm-hmm.
So, when you enter government or when you become like a Singapore's leader, do you kind of go through training, or do you have like a set of notes to look at to say, this is how Singapore would respond to a crisis?
Thank you. I think to start with, every crisis is different. So even if we have SOPs, these will have to be adapted as we go along and as we have more and more information. And for Singapore, I think we are very fortunate to have a very strong public service. Our civil servants, our senior officials are very well experienced and well versed in handling crisis, because COVID-19 was not the first crisis. There were many crises before. And they are quite experienced in working together as a team in tackling a crisis. Particularly, specifically for COVID-19, I think we had news about the outbreak in the late 2019. By the time we are already watching it very carefully, and we started thinking about how Singapore is going to respond if we have a case in Singapore. And that's why we started preparation quite early on, and we decided to establish a multi-ministry task force to tackle this issue. And of course, we had a SOP because we did have an experience with SARS. Wasn't a very pleasant experience, but we were able to tackle the crisis, and we developed a set of SOPs in handling a pandemic. And given that COVID-19 was a very similar virus, it was a coronavirus, so we took out the SOP, dust off the pages, and read through the SOP and figured out what our plans would be. And we assembled a multi-ministry task force to discuss what will be our immediate preparation that needs to be done. Things like preparing our quarantine facilities, getting the healthcare system ready. All these were being put into action. I think, but as things unfold, as the crisis unfolds, I think you will remember that we had many changes. Sometimes we took 2 steps forward, 1 step backward, mainly because we didn't have all the knowledge and information that we needed in managing the crisis in the beginning. Because we knew very little about the virus, we assumed that it was like a coronavirus, like SARS, but it turned out to be very different from SARS. So as new information came in, we have to adapt and adjust our strategy and our approach in dealing with the crisis. I think in future crises, it's going to be the same. We will continue to update and refresh our SOP, but we must always be prepared to adapt and to change our strategy when new information becomes available. I think that's the way to handle crisis.
Absolutely. When you looked at the SARS SOP, right, what was something that you looked at it and you said, okay, I think this is actually the most important thing, or maybe like the most helpful thing that could help me in managing COVID?
I think from our experience in SARS, we decided that we cannot immobilize a hospital just to handle a pandemic. Then you lose the capacity of a hospital. I think during SARS, we lost the capacity in the Tan Tock Seng Hospital because that was used to handle SARS patients. And then the capacity became a very constraint. So we decided to develop a National Center for Infectious Diseases, NCID. And it's fortunate that NCID was just completed in 2019, end of 2019, and was started to be operational in the beginning of 2020, just in time for COVID-19. I think this is one experience that we learned. And we also learned from SARS that communication is very important. And that's why when we handled the COVID-19, we decided from the beginning that we will maintain transparency. We will explain to Singaporeans the way it is. We will share the facts. Good news, bad news, doesn't matter. We will share with them so as to build trust between the government and the people. I think trust is very critical in a crisis so that we can come together as one people in tackling the situation rather than to be second-guessing each other and whether you're telling us the truth, whether there were hidden agenda, and whether there were information that you are concealing. I think transparency and trust is very important in handling a crisis.
Got it. You know, you earlier on you mentioned putting together this multi-ministry task force. And in an agency like ours, like when we have new projects come together, there's this whole idea of like coming in together into the meeting room and having this war room meeting, right? And I feel like it's actually based on, you know, like people like yourselves, like world leaders coming together to like solve problems. So when when the multi-ministry task force was put together, did you guys have that war room meeting? You know, did you guys go into a meeting room, sit down, and then just trash out, okay, these are our priorities, these are what's important. Like if there was a meeting like that, how did it go? And if there wasn't, like what was actually what was the first thing that the task force did together?
First, I think I personally called all the ministers that were involved to explain to them the background and the threat that we are seeing and to assess the situation and explain to them what we plan to do and invite them to come on board the MTF. And then we had a first meeting. And as I mentioned earlier, I think at the first meeting, we did have a war room and we sat down and discussed what are the immediate steps and what the various ministries have to start working on in preparation for the arrival of the first case. And we gather regularly. We have meetings almost every week and sometimes 2-3 times a week when the situation calls for it. And we came together, ministers as well as civil servants come together as a part of the task force to chart out the operational plans to implement our various measures, including circuit breaker, if you remember, as well as various safe distancing measures.
Right. Were there any like frameworks that you guys used in organizing priorities in that war room?
We do. We look at this. First, we start with the assessment of the global situation because that is important. The pandemic is not just Singapore, but global. and therefore we need to have appreciation of what's happening in the rest of the world. And then having discussed the global situation, have a risk assessment of the global situation. Then we talk about the local situation, how is it evolving, and what are the next set of measures we need to roll out to address the issues of the crisis. And then having discussed measures, then we go into discussion of a specific operational challenges. Because it's easy to plan, but it's very challenging to implement because these are very complex operations, and time is always a major constraint. So we need to discuss with the operating teams to decide on how to implement the various plans that we have. And the key really is, as we discuss, we want to keep it as simple as possible because it's a very complex national operation. And to make sure that it's effective, we need to very often simplify the processes. The measures may not be perfect, but I think simplicity is a priority to make it simple, easy to understand, so it's easy to implement, and also easy for Singaporeans to understand and to comply with the various plans that we put in place.
Understand. And what would you say was that biggest challenge in that entire process? You know, you mentioned implementation is one. But what was the most difficult part of that experience?
Well, I think it is very difficult to pinpoint which particular challenge is the most difficult one because we do have many challenges. I think one of the important one is really the lack of information about the virus. Our initial playbook was based on SARS. And in SARS, we knew that a patient is very infectious, particularly when he's very ill. And that's why we recommended that Singaporeans don't need to wear masks until they are sick, because when you are asymptomatic, you are generally not infectious. But later on, we discovered that from research and scientific data, we found that actually a patient is infectious even before he became symptomatic, and therefore you never know that you're infectious before you are sick. And therefore, we decided to change the narrative and say that everyone should wear masks. But it is very difficult because we have convinced Singaporeans that you shouldn't wear masks, and to change the narrative and convince Singaporeans that now you should wear masks, it's a very difficult process. And we decided that communication is very important. And we asked Prime Minister Lee at that time to go on TV to explain the situation and to encourage Singaporeans to wear masks whenever you can. So I think we need to focus on communication, which is a second challenge, because without full information, it's also very difficult to explain to Singaporeans and to address many of the questions they were asking. So even at press conferences, you will notice that from time to time, we have to be honest and say we really don't know. And we will share when we have the information. I think the key guiding principle is really to be transparent, to be as honest as we can with Singaporeans. We know, we say we know. If we don't know, we just have to say that we don't know. And then we will share whenever we have that information. So I think this way, we can build trust, and when it comes to difficult decisions, Singaporeans will then trust the government and follow our instructions, including wearing masks.
I mean, when we speak about the masks and switching, I think what I remember from back then was even then, I was already consuming content whereby people were saying, oh, you know, you should wear masks from the early onset. And then there were a group of people who were already championing that, right? So I think that's a new challenge, you know, that I think someone like in your position would have to face, because while you're implementing Plan A, there are others out there who's very loud about Plan B. And I think because there are, like, social media allows for so many diverse voices to have a voice, you know, they can say, this expert said this. So then isn't it so difficult that, you know, you have to deal with now people who, I wouldn't say, you know, I mean, everybody's, I feel, has good intentions, you know, when they are trying to educate the public, right? But if it's directly against what you're trying to do, like, how do you then navigate a situation like that?
I think the key really is still being transparent. When we share the reason why we said that there's no need to wear masks, we show evidence, we show scientific proof, and we also provide a recommendation from the World Health Organization. But when we decided that with new evidence emerging, we have to encourage Singaporeans to wear masks, we did so even before WHO changed its position. So we decided that once we know, better share with Singaporeans as soon as possible. I think this way you build trust. And there's another incident on the social media. If you remember, in the early days, there was speculation of how many cases every day, and there were a lot of numbers being floated around. So we decided that we have to be more frequent and more timely in our information. And that's why we set up a WhatsApp system, if you remember. We sent government messages through WhatsApps to inform Singaporeans about the situation in COVID-19. And there were also rumors where there's an outbreak here, there's an outbreak there. We used the WhatsApp message to communicate with the Singaporeans and tell Singaporeans that there's no need to listen to rumors, because we will tell you when there is indeed an outbreak. And through this communication, I think we will build trust. You can't stop social media from sharing their views, their opinions, their advice, and some are true, some are not true. You just have to share what is actually what you believe in and what the government's position is. And we always have to base on facts and figures and scientific data. And this way we will be able to convince Singaporeans.
In crafting my questions for you, I was thinking, okay, if I'm put into the position of being in a task force and having to deal with such a massive problem like this, clearly there will be trade-offs, and clearly there will be different factors to weigh in and whatnot. So what were those factors that you had to weigh, and what were the decisions and trade-offs you had to make in that process?
I think there will always be trade-offs in any decisions when in a crisis situation. But it's important for us to always be focused on our core mission. I think the MTF was very clear that our mission is really to save lives and preserve jobs. And these are the twin objectives that we have to focus on. And this was a task given to us by Prime Minister when we set up the Taskforce. And therefore, we always have to prioritize saving lives and preserving jobs and livelihood. And therefore, I think this is how we go about doing it. But there were situations where we really needed to decide on the trade-offs, even saving lives, for example. Let me just cite an example. When we decided to introduce circuit breaker, we know that livelihood would stop. And therefore, we roll out support schemes to help those who have lost their income and unable to cope with the cost of living every day. So we provided financial relief for our families, and we roll out many series of budget to support. And we also supported the businesses, because we know once you have a circuit breaker, businesses will not be able to operate. But at the same time, even if saving lives, we also are concerned that particularly those who are elderly, those who are living alone, how do we take care of them? If you have a circuit breaker, then you can't visit. So we made specific exemptions for visiting elderly to make sure that those who have elderly parents living alone, you are allowed to visit them. And we also encourage them to bring the elderly home so that you can take care of them during the circuit breaker. So I think these are trade-offs that we always have to balance. And when we begin to open up to lift the circuit breaker, we also had to trade off. Because again, we were wondering which part of the circuit breaker should we lift first? Which part of the restriction should we lift first? I think we decided to lift, again, the elderly first. So we allow a visitation to elderlies, a more frequent engagement with the elderly, because that's important to keep them safe and healthy. So I think this is something that we have to balance. We also decided that we should resume school education, because we also decided that education is very critical. And if your young children miss their education during their formative years, it will create a significant impact for the rest of their lives. And therefore, we decided there's a risk, but we want to manage the risk as the best we can. So we have safe management measures in schools, but we decided to reopen school very early so that children can resume their education. But of course, we also have home learning programs to help them to do distance learning through Zoom and through social media, continue their education. But it's not the same as a physical interaction. So and the learning the social skills. So we decided that we need to physically resume school programs, but we do so very carefully. So in the beginning, we decided that the physical activities like PE and sports, where you have a lot of contact, should be minimized. But classroom learning, we should resume as much as possible. So I think these are trade-offs that we will always have to assess, measure, but you will need to move ahead. But even if you have trade-offs, you always look at how we can minimize the downside in any of the trade-offs, so that we will have a good outcome at the end.
Understand. So now that everything has kind of like settled and you have the value of hindsight and you're able to reflect and look back, what do you think went right and what do you think we did well in? And at the same time, what were some things that you think we could have done better?
Well, first, I must say that we have a very strong civil service. I think when we make decisions, the civil servants have to carry out and implement on the ground. As I mentioned before, the operations are very complex. Say, for example, we have border control. Sometimes we have instructions of no landing for certain flights from certain countries or regions. It's easy for us to just say, okay, we stop this country from flying to Singapore. But on the ground, the airports, our border control have to put into action our decision. And it's very difficult for them to figure out whether this person flies directly from that country or transit from other countries. And because it's a very complex operation at the airport. And it's not just the immigration, customs, and even our Ministry of Foreign Affairs has to deal with other countries to make sure they understand why we are doing so. It's not targeted at them, but because of infection control. So I think these are operations on the ground that are very, very complex. But we are very fortunate to have a very strong civil service, and they put the machinery into operation. I think that is one very important factor. The second factor is really in a crisis like COVID-19. This is not just the government that's doing it, because we also need to mobilize the private sector to help us implement some of the massive undertaking. One example is the quarantine facilities at the Singapore Expo. If you remember, in the early years, we have community care facilities at the Expo, and it's a huge undertaking. We have to mobilize many of our private sector operators to come and help us operate these facilities. We also tap on the hotels, if you remember, because we have no tourists at that time. So we tap on the hotel's capacity to use it as a quarantine facility. And the hotel operation have to overnight turn around to operate it as a quarantine facility rather than as a hotel. You can imagine hotel operators are used to having activities to encourage interactions, socialization, and to encourage dining in the restaurants, consumption in the hotel. But now they have to turn it around and say, please stay in your room, please don't come out. It's a totally different operation. And we are very happy to see that the private sector were able to step up when we call on them to work with us. And finally, I think Singaporeans, every Singaporean play a very important role in the tackling of this crisis. And again, in order to do that, we need to have trust. The trust between the government and the Singaporeans is very important in persuading Singaporeans to come along. Mind you, many of the measures are very, very difficult, very, very, very harsh, I would say, including a circuit breaker. You ask them to stay at home and don't come out. It's not easy, and it's not just 1 day, 2 days, so it's quite a prolonged period of time. Of course, we encourage them to continue to exercise, keep active, but minimize social interaction. I think that's a major challenge. And you can see in many other countries, their social distancing measures were not effective because the population just don't trust the government and don't comply with the instructions. But in Singapore, we're very fortunate to have that trust that built up over the years. And because of that, Singaporeans were very compliant when it comes to safe management measures. So I think this is the key ingredients how we were successful in managing the COVID-19 crisis.
Mm-hmm. And what would you say were the things we could have done better?
I think what we could have done better, there were quite a few. I think mask wearing is one example. Mm-hmm. I think in hindsight, we could have said that, start wearing masks from the beginning, but we didn't have the information. And based on whatever we had, there's no reason for us to wear masks. But eventually, when we decided that from data we ought to wear masks, immediately we went out to tell people to wear masks. I think what we could also have done better is in terms of rolling out testing. In the beginning, there was only the PCR tests, mm-hmm. which is very accurate, very precise, and that was the gold standard in testing infection. And we stuck to the use of PCR tests. But PCR tests are very difficult to scale because it takes time for the process to process the test samples, and it also takes time to take the samples, and therefore the results will come much later. And as you know, at the thick of the crisis, the pandemic is spreading very quickly. The PCR test just couldn't catch up, and the quantity that we can undertake for PCR tests is also very limited. And therefore, we decided that we should move away from PCR tests to what we call the rapid tests. And you know, ART tests, all of us have been using it. We do our own swab ourselves. And we could have moved earlier and faster in switching to ART tests. But because we needed to make sure that ART test is effective. It's not 100%, but it's important not to allow perfection to be the enemy of good. So I think ART tests, eventually we found that it's good enough.
Understand. So I was thinking in terms of like business interest needs and everything. If I was a hotel and like someone comes to me and say, oh, you know, I'm going to turn your hotel into a quarantine facility, my instinctive reaction is probably no, because, you know, one, like what if the perception of my hotel, you know, becomes this like, oh, disease location, you know, and I wouldn't want that. I think this is just an example of the many ways that the private sector could be resistant to working with people like yourself. So what would you say would be the reasons or factors in which you were able to convince them to work with you? What was it really that allowed you to have that collaborative relationship with the private sector?
I think it's also the trust that we built up with the private sector over the years. And whenever there were crises in the past, we helped them, support them. And they also trust that we will continue to support them even through the crisis. And it is also a situation where you find that there were no tourists. And so they didn't have any visitors, any tourists occupying their rooms anyway. So they looked at it and thought that it will be a good alternative use. And since many hotels are involved, they are not the single hotel that became a quarantine center. I think that will be more difficult to persuade them. But when they see that we are mobilizing all the hotels, they figure out that, well, if we are all in this together, I think it's better to be part of the strategy to address the issue so we can get out of COVID-19 as soon as possible and the hotels can get back to their business as quickly as possible. I think that's what motivated them.
Got it. You know, as I'm talking to you, I'm realizing, wait a minute, you are one of the very few people who have worked under 3 different PMs now, right? So there was PM Goh Chok Tong, there is PM Lee Hsien Loong, and now PM Lawrence Wong. I think you're in a very unique position to be able to share maybe insights. So maybe through you as proxy, like what is it like working with each one of them? What is maybe one leadership lesson that, you know, you can share from each one of them? And you're now the DPM, you know, as someone in your position, what would that brand of leadership look like for you? And what are you maybe borrowing and adapting from each one of their leadership styles that you're bringing to your own personal leadership style?
Well, first, I must say that I actually worked with all 4 prime ministers. When the late Mr. Lee Kuan Yew was a prime minister, I was working in the government as a junior civil servant. You don't get to see prime minister that often when you're a young junior civil servant. But I had a few opportunities to interact with him and sit at the meeting, and it's always very inspiring because he has a very deep insight into issues and he has a very broad experience in dealing with international affairs. The late Mr. Lee's style is very clear, very decisive, and he will always make a decision and just move. Because at that time, I think we are at the beginning of our nation building. We have very limited resources, and we need to focus on building the nation. And therefore, we were able to bring people together, and all we need is a very clear direction, and we move in the same direction. I think it is something that we also have to learn, especially in managing a crisis. Sometimes you don't have a full set of information, and you can't just keep asking for more information and not making a decision. I think then you will miss the boat. And when Prime Minister Goh Chok Tong took over, he decided to go for a more softer approach and engaging people and creating a more caring, more inclusive community. So his style is very different. He will talk to people. He wants to get people to understand his policy, spend time explaining his policy, and also to get feedback. And that's also what I take away from him. And therefore, in dealing with my ministry official staff and so on, you also need to take a softer approach, allow them to make suggestions, allow them to have their own ideas, guide them along so that there's a strong ownership of the outcome, of the solutions that they develop. And when it comes to Senior Minister Lee, when he was a Prime Minister, he was very consultative. He wanted to get views from people, engage Singaporeans and to get feedback, to get views. He wants to make sure that the policies, decisions are well considered before implementation. And he also focused on communicating with the people, sharing the issues with the people. And I think this engagement style is also something that I hope to learn. It's not easy because sometimes when you engage Singaporeans, they have many ideas, and you need to sometimes you need to learn how to say no, because it's just not possible to do everything for everyone. At the end, you need to have trade-offs. That, as you said, I think Mr. Lee was a great communicator in that sense. When it comes to a crisis like a COVID-19, as you have seen him on television, he's very persuasive. He will take Singaporeans through step by step, systematically, and explain the situation and bring people along. This ability to mobilize support is something that I hope to be able to learn. It's not easy. Sometimes it's your own character that makes a difference. I think Mr. Lee has that persuasive character. People trust him, they believe him, and when he says we have to change the strategy, and people will follow him. And Prime Minister Lawrence Wong is quite different. He's a fourth generation leader. He has his own style, and you can see he's very engaging, and he's very comfortable talking to people and getting people to understand who he is, what he stands for, and his approach to leading Singapore forward. So I think that's why he wants to lean forward in engaging the media, engaging different segments of the population. He also wants to forge a new social compact among Singaporeans. And that's why he started this Forward SG movement to get Singaporeans to talk to each other, to talk to the leaders, and for the leaders to talk to them so that we can come together to have a shared vision going forward. And this way, I think he wants to bring whole Singapore together as one society and one community. This forward-leaning approach in engaging Singaporeans is something that's very refreshing. And that is why I'm also on this podcast. Something that this is my first time. So as you see, we are all learning. So one lesson that I learned from working with all four of them is every leader has to evolve his own style that he's comfortable with. And all of them did not try to imitate the previous leader. I think that is very important because Singaporeans really want to know who you are, what you stand for, and how do you intend to bring Singapore forward, and how do you intend to improve my life. I think this is something that every leader will have his own style and his own approach and strategy in going forward.
Great. Hey guys, I just wanted to quickly jump in and tell you that if you're enjoying the chat so far and find this discussion insightful, please show us some love, tap the follow button and drop a 5-star rating on Spotify and Apple Podcasts. And if you're on YouTube, hit the like button and subscribe. Okay, let's dive back in. So I love watching apocalypse movies, whether it's World War Z, The Last of Us, whatever. Mm-hmm. The most interesting thing about all those shows or movies is how people would react, right? And not unexpected, but I did see some countries making quite selfish moves during that period, right? I'm not going to name names. I think that's not part of my intention here as well. It's just understanding how would you, as someone in the position of a nation's leader, react and respond in a world that maybe doesn't really play fair. Do you still play by the rules? Do you still play nice? Because what if playing nice puts you at a disadvantage or puts your people at a disadvantage?
So first, I must say that our position has never been a decision to stay neutral.
Okay.
Because even though we may appear to be neutral, but we always take the principled approach. Our decisions will always be based on principles, key principles that we articulate, and also always have Singapore's long-term interests at heart. So that's the basis of our decision. So sometimes, therefore, you see that we may upset one side or upset another country, but when it is the right thing to do, we have to stick to it and be principled about it. And because of our principled approach, I think countries respect us and they also trust us, and we will become a reliable partner in a crisis situation like this. So, and when the pandemic happened, of course, there will be tension between countries. Even for essential supplies, there will always be issues. Who gets it first? And for us, we always respect rules and order because that is important. Otherwise, as a small country, we will always be at the short end of the stick. So I think it's important for us to continue to uphold the rules and order, and at the same time, be principled in our approach and always have a long-term interest of Singapore at heart. And even for our bilateral relationship with some of our neighbors, there were issues during the COVID-19 pandemic, if you remember, when Malaysia had the mobility order, and Singapore, we have our circuit breaker. Actually, the connectivity between Singapore and Johor was severed. I think the causeway, we used to have 200,000-300,000 people every day, suddenly dwindled to just a handful. And that was quite critical because our essential supplies like vegetable and eggs and so on would not come over. Our essential workers that were stuck in Malaysia couldn't come over to Singapore. And similarly, many of our products couldn't be delivered to Malaysia. And some of our Malaysian workers who were in Singapore at that time couldn't go back. So we had to deal with this issue. And it's very fortunate that between Singapore and Malaysia, we had very good bilateral relationship. We have trust between each other. And we also realize and recognize that we are in this together. So we had very close working relationship between the two countries at the immigration level, at the law enforcement level, at the customs level, and even at the trade and industry level. So we were able to sit down, work through the system and to reopen the causeway in a very careful and managed way. I think trust and confidence is very important in a crisis situation, whether it's within Singapore or whether it's our bilateral relations with our neighbors or international multilateral relationship. I think that is very important.
Understand. I have a friend group, and please bear with me. I have a point to this story, whereby all my friends are very opinionated, in that friend group, and they're always going at each other, and they're always like the discussions can lead to yelling matches sometimes. And I was sitting there like, what is going on, And for me, I stay out of it because I'm like, it's just them going at each other until they both turn to me and go like, okay, what do you think? Tell me whose side you're taking right now. And then I panic, right? And I'm like, okay, then I need to recalibrate and say, okay, let me give you my honest opinion and my assessment of everything. I think in a similar kind of fashion, was maybe the vaccine and how, the US was pushing for their vaccines and China was pushing their vaccines. I understand that Singapore's friends with both, right? But when both of them were trying to push out to the world, and it became this, I don't know, my perception was a tension point whereby if you buy theirs, you're not my friend, that kind of vibe, right? How do we navigate that? And how do you not piss the other person off?
Well, that's a very good question. Vaccines is a very good example, actually. And from Singapore's point of view, you must accept that in the beginning, we didn't have any vaccine. And when the many countries, many pharmaceutical companies were developing vaccines, at that stage, we really didn't know which one is going to work, right? And vaccines usually takes quite a long time to test and to verify the effectiveness and also to minimize the after effects or the side effects of the vaccine, and that takes time. And therefore, we had to make a decision, and we decided that we will place bets on a basket of vaccines so that if any one of them became effective, and fortunately, we have placed an order. So we actually placed order for several vaccines based on initial reports, and we make an assessment which are the ones that are most promising. So we betted on quite a few. We placed advance orders for quite a few, and fortunately, many of them came through. I think we were fortunate to be able to have access to the first initial vaccines. Whether they were from Europe, US, or China, really doesn't matter to us. We focus on data, science, and evidence. And based on this, we also have a team of experts in infection disease and in vaccine development to advise us in terms of which of the vaccines have shown evidence of effectiveness and minimum side effects. And we went on a professional advice. So I think to whatever countries that may be, like our friends who are quarreling, so I will tell them that let's focus on whatever is effective. Let's focus on science and data and show evidence. And for us, we just focus on that. I think that's the best approach in dealing with a crisis.
Understand. When you guys are representing Singapore, or even as the task force, right?
Mm-hmm.
My perception is always whatever you guys are saying on a united front,
Mm-hmm.
right? And even as a team, we have our internal discussions, and whatever we decide on publicly, we will say it obviously as a team, But I'm curious about the behind the scenes, right? As with any individual, group of individuals coming together, there will be different opinions. There will be different people with different priorities. What is that like, and how do you navigate differences within a team? I think that's what I'm curious about as well.
Well, in the system, we whenever issue crops up, there will always be differences in opinion and differences in the in terms of the solution that we should adopt or the approach that we should take. Just taking COVID-19 as an example, when we discussed the circuit breaker, it was a very critical decision. Yes. So there were differences in opinion whether we should or should not do. And eventually, I think Prime Minister Lee at the time said that, well, why don't we sleep over it and think about it, and we come back next day and make a decision. So eventually, when we came back, of course, there were still differences, but we have to move forward. So we consulted the professionals. Eventually, we have to make a collective decision. I think we did. Once we decided, I think we all have to back the decision and all have to implement the decision wholeheartedly. I think that's the hallmark of this government, that once we decided, even if you don't agree with the decision, you must do all you can within your portfolio to support this decision. But if the decision turns out to be incorrect, and you need to change direction, we are encouraged to voice up your opinion, your suggestion, or your feedback that this is not working on the ground. And therefore, we can then make a collective decision again to change direction. And again, once we decided to change direction, everyone follows and supports the decision. This way, I think we can move ahead in unity. But at the same time, we have diversity in terms of views and opinions and solutions that you provide.
Got it. So I want to go back to our conversation on the international playing field during COVID, right? Again, going back to the movies, I think these movies always explore the human psyche and also our, it kind of reveals our morals or our values, right? In situations whereby it's life or death or in crisis, yeah. Based on what I was reading, there were some countries that actually played dirty during that period, whether it was vaccine hoarding or, just protecting their own interests, right? Were there opportunities for Singapore to play dirty? And what did we choose to do in those situations?
Our approach has always been a collective one, whether it's within Singapore, looking at the global situation, because we also believe that unless the world is safe, Singapore will never be safe. Because pandemic is so pervasive that you just keep Singapore safe for a while, but it cannot be forever until the whole world is safe. So our focus really is in how can we keep Singapore safe, at the same time do our part in helping others to be safe too. So during the crisis, if you remember, other than bringing vaccines to ourselves, we also deliver vaccines to our neighboring countries, and using Singapore Airlines as a delivery conduit to help deliver some of the vaccines to them, so that we can help our countries to also be, our neighbors also be safe. So I think this has always been our approach. And therefore, whenever we have, as I mentioned, we have advance orders for vaccines. When we have delivered the first batch and then the subsequent batches, we will prepare to share with our neighbors, because we already have sufficient for our first wave of vaccination, so that we can make sure that our neighbors also have access to some of them. But of course, Singapore is very small. The amount that we can share is also very limited. So within what we can do, we will lean forward to help others. This is not just during COVID-19. As you can see, whenever there's a crisis, when we can, we also deliver relief for other countries. But we also have to recognize that every country is different, and it's difficult for us to judge other countries on whatever action they have taken, because their situation may be different. They may have a crisis at home. They may have other considerations. So we just focus on what we should do and what we should, the approach that we should adopt, always taking into account Singapore and Singaporeans' interests.
I understand. Actually, that led me to another question about leadership, right? Because there is, when you're in a position to make decisions, it comes with sometimes just risks that you don't know whether or not it will pay off. And my leadership style is that I like to make very calculated risks, even if, the outcome might not be guaranteed. Drawing it back to the vaccines, it's like you obviously have resources in terms of like money, and you have to invest, I guess, in vaccines that may or may not work, right? Walk me through, maybe, as you just said, with your senior officials, what were some of the key considerations as to what you were looking out for to make sure that, you don't just blindly throw your resources at things that could very well fail. Yeah.
First, of course, we look at the fundamental technology, whether that technology has been proven effective in other vaccines. So if it has been effective in other vaccines, to use the technology to develop this COVID-19 vaccine is more promising. Right? So we also look at the capability of the pharmaceutical companies that are developing it, whether they have the resources to be able to sustain the effort of development. We look at many factors. And of course, at the end, we also consult the experts to tell us whether the R&D approach they have taken is sensible, or whether they are likely to be on the wrong track. And time was also of the essence. We also look at whether this particular pathway is going to yield results soon enough, or is going to take too long to be effective. So all these are factors that we will consider. And we also look at whether we could afford some of the vaccines very costly to develop. We felt that it's not possible for us to participate in this. And therefore, these are the factors that we'll consider. But at the same time, in any decisions like this, whether it's vaccines or whether it's safe management measures, there will always be risks that you put in, it doesn't happen, and there's a downside risk. I'm sure when you develop podcasts, you also assess what could go wrong.
Yeah.
And because in COVID-19, we're dealing with lives and with people's livelihood, so the downside impact is very severe. So we focus a lot of our resources and energy in assessing what could be potentially an adverse outcome. We want to make sure that we address the adverse outcome, minimize it, and to have a confidence that we are able to manage the downside if it does happen, if it didn't turn out what we expected to be, and we are prepared to move quickly to minimize the impact on the downside. I think once that is done, we have confidence to go ahead, make the assessment, you have confidence, and you move ahead. But you always, at the back of your mind, you know that the downside of not making a decision is the greatest. So therefore, assess the downside, mitigate the downsides to the extent possible, but you need to make a decision and move forward in the absence of perfect knowledge. I think that's true in COVID-19, and that's true in doing business too.
Understand. Is this part of maybe a larger framework as to how you guys would approach, in general, risk assessment and how resource allocation? Or is it more of like a case-by-case study, maybe from the SOP from SARS? I don't know.
No, in fact, this is the way we approach, not just about crisis in any policy decision, even during peacetime, ordinary policies. We also have to assess the downside because, as I said, there's always a trade-off. You have to assess, is the trade-off wearable? can we persuade people to accept the potential trade-off? And if there is a need for the trade-off, can we minimize and mitigate the trade-off? Can we help those that are affected? And this way, we will then make the policy more wearable, and we can get support for the things that we want to do for the long-term good of Singaporeans.
So for the last part of my conversation, I think I want to look forward, right? I think when SARS was over, there was this feeling of this probably won't be the last, And then, of course, COVID came around. And when COVID was over, there was this sentiment that the next one is not a matter of if, it's a matter of when. So if we have that in the back of our heads, what do you think was some of the key lessons that you learned that you will put into now the COVID SOP that whoever is going to be leading Singapore through the next crisis can refer to?
Well, I would say that the first line in our SOP must be to expect the unexpected, because it is very important for us to always bear in mind that no two crises is the same. The SOP is what it is. It's a SOP, but it's useful reference for you to kickstart your system, your framework, your operations, or your preparation. But you must always expect the unexpected. Be quite prepared, be nimble so that you can change and steer as and when necessary. But if you stick totally to the book, I think it's going to be a disaster. That's what we learn every crisis. So SOP is still very important, very useful, but always be prepared to adapt and to move very quickly. And again, I think a few key lessons we learned during SARS and particularly during COVID-19 is that communication is key. Being transparent, win the trust of the people right from day one. Good news or bad news, I tell you what it as it is, so that next time when we tell you this is the situation, you will believe me and you will trust me. So I think that trust is particularly important in a crisis situation. And we do expect a crisis to happen. Pandemic, I think the next pandemic is not far down the line. And as you can see, historically, the cycle time between major pandemics is getting shorter and shorter. So we should always be prepared for the next pandemic. And beyond pandemic, there are also other crisis situations. I think you have seen financial crisis, economic crisis happening, and there may be also geopolitical crisis. They may be brewing, and we have to always be prepared that we may stumble into a crisis situation, and we have to react and we have to respond. We always have a SOP for many things, learning from history, learning from our experience and the experiences of other people. But it's important to always be prepared for the unexpected so that we can be nimble and adjust and adapt our approach as we go along.
Yeah. Learning from experience is one of the things that I think AI can help in that. I think I was having dinner the other day with someone who was so interesting. And actually, I say conversation, but it was really a monologue from him because he just kept going on and on and on about his work in AI. And he was so fascinating because he was saying how he's basically creating a second version of himself by logging down his journals every night, speaking directly to AI, and then using psychology to then create his own persona on a digital basis. So if one person can be thinking like this, I think in maybe 10 years' time, it is not maybe too far an idea that, an AI or robot version of myself can continue to live in years to come. So where I'm getting at is that, if maybe in 100 years, there can be a gun GPT, right? And I'm the new leader of the new Taskforce that has to deal with a pandemic. And I log into Gan GPT and I say, help, I'm about to enter my meeting in my war room meeting. Like, what is the first thing that, you'll say to me in dealing with the next pandemic?
Well, as you put it, this AI bot, imaginary AI bot that you're thinking about, is still a library of experience, of wisdom, and decisions in the past. It will be very useful in a crisis situation. In fact, the next crisis will probably make use of AI to give us information, more exhaustive information around the world. Today, we depend on what we have, but in time to come, we will then be able to source data from all over the world and experiences of similar occurrences to give us a better basis to make a decision. But at the end, as of today, I think you still need to make a decision. AI won't be able to decide for you. They will give you options and they can tell you the potential impact of your decision of various options. But at the end, you still need to make a judgment call in terms of the trade-offs. And that is, I think, where human beings will still be necessary. You may have the benefit of all my wisdom or whatever that is, and my experience in the AI bot. But at the end, you will still have to make a decision because you are you and you are not me.
Understand. And in having a crisis preparedness strategy, other than, expecting the unexpected, what is that framework? I keep saying framework because I don't know how else to think about it, right? Because I'm always thinking in frameworks, I guess. Whether or not, business decisions, personal decisions, I'm always looking online or on podcasts, on YouTube videos, like what, or through books. What are frameworks to approach, right? If you were to kind of give us a framework as to how to approach crisis preparedness, what would that look like?
Well, the framework includes many parts. First, you have to look at the resources. You need to allocate your resources at a broad base. You need to look at resources. Second part of the framework is you need to prepare for your communication. Because as I mentioned, communication is very important. The third part is also in terms of, depending on the nature of the crisis, you may need to think about international relationship. If it is a global situation like pandemic, you need to mobilize Ministry of Foreign Affairs or missions to get information, to engage them and so on. And lastly, you need to think about how to mobilize your people, your own teamwork, your team, to be able to get ready for it. And even in the resources, you need to think about how to prepare some of the resources, some of the things we have stockpiled, some of the things that we have pre-prepared. Let's say quarantine facilities. Actually, we have pre-prepared some of the quarantine facilities. And then that's a broad framework in terms of resources, in terms of communication, in terms of international relationship, and in terms of mobilizing your team. So I think that's the important part. But in order for you to do all this, your guiding principle must be your core mission. You have to be very clear what you are trying to do, what you are trying to achieve. So I think that kind of a framework, knowing that there are different components of your plan, you need to take care of them. And each of the member in the task force were given specific tasks of each of the component in the framework. And that way you make sure that they are being looked after. If everything comes to one person, I think it's going to overload that person. So therefore, we have a very good teamwork and we are able to distribute the responsibility. And we are very fortunate that each of the leaders were very responsible in their particular area. And I was also very fortunate to have a co-chairman that will share the responsibility with me. So when I make decisions, we don't make on as individuals, we always consult one another, and subsequently Minister Ong Yi Kang joined in as a co-chairman. So the three of us will discuss and come to a collective decision. I think that helps because if it's a single person, I think the responsibility will be very, very heavy. So I think we were fortunate to start off with a co-chairman structure.
Okay. Well, you're currently in a new leadership team. Let's ignore that the GE is coming. But let's say, the next crisis, the next global crisis is coming tomorrow, right? In your opinion, do you think the team is ready to face that?
I would say that we are more ready than before. We learn from every crisis, but we can never be fully ready. As I say, you must expect the unexpected. The crisis will always throw us a curveball. If there's nothing new, it's not likely to be a crisis because we would have nipped it in the bud before it became a crisis. The fact that it will become a full-bloom crisis is because it's something new, something we hadn't expected, and we just have to keep adapting ourselves. I think our nimbleness and our strong teamwork, and particularly the trust that we have developed, is very important, and we must preserve that so that we are in a strong position to tackle the next crisis. We must always continue to learn, not even just from our own experience, but also from experiences of other countries, how they manage the crisis. And there are many things that we can learn from them too, how they deal with even COVID-19. I think it's something that we constantly learn, constantly evolve, and always keep a lookout, monitor the development globally, whether it's pandemic or other forms of crisis, so that we are a little bit ahead of time And even the formation of the MTF, for example, we formed the first MTF. We had the first meeting and we announced MTF before the first case arrived in Singapore. And there were people who asked us whether we are overreacting. So my response is it's better be prepared than not. So I think we just want to be one step or at least half a step ahead. I think that will put us in a stronger position.
Got it. All right. My final question. When you look back on COVID-19 and your role in the task force, and now obviously you have the role of the DPM, was there one lesson or was there one thing that you learned that would help shape, your leadership qualities or approach in your role as DPM?
Well, there are many lessons to learn. So it's very hard to sort of crystallize into one particular lesson. But I would say that we must focus on building teamwork, building trust, even under normal circumstances. Because in a crisis, it's very difficult to build trust and partnership. So this partnership, teamwork, and trust has to be done during normal times, so that you are better prepared for a crisis. And as a DPM, my job is really to support the Prime Minister in helping the team so that we can move forward, and to also help Prime Minister in looking into specific areas that are across ministries. I think that is a part and parcel of our work. And this experience during the multi-ministry task force has been useful, because in MTF, we also have to coordinate and work with different ministries and tap on the resources and the leadership of the various ministers in different ministries in order to achieve the outcome that we want in the COVID-19 situation. So I think going forward, it's the same. We do have challenges going forward, whether it's geopolitical tension, whether it's our economic strategy moving forward, a social compact among Singaporeans, building cohesion in Singapore, building an inclusive society. These are key challenges that we will need to deal with. And many of these challenges increasingly are not confined to any particular single ministry. It's usually or almost always across ministries. And therefore, I think as DPM, I have a role to play to how I can bring the different ministries together to tackle specific issues that are across the board.
Yeah, thank you so much for sitting down with me and going through all of this. I've been dying to ask some of these questions for 5 years now. So I'm just happy that, I finally got some of the answers that I was looking for. So, and also, thank you for letting us be your first podcast. That's crazy. No pressure there. But yeah, I appreciate you having taking the time out to do this.
Thank you so much. I enjoyed it.
Thank you.
Thank you.
Guys, I really enjoyed that conversation, and I am so glad that I finally got the answers to questions that I've been thinking about for 5 long years. It was also fascinating to hear about the leadership side of navigating such a huge challenge like COVID-19. There were definitely some takeaways there for my own learning journey also. Now, huge thanks to DPM Gan Kim Yong for sharing his thoughts with us. If you like this episode, please hit follow and give us those 5-star ratings. And if you're on YouTube, let us know what you think in the comments as well. What was your biggest takeaway? I'll see you in the next episode. This was the Zoda Pop Podcast.